So I'm Claire Murdoch, I'm the National Director for Mental Health, and I've spent the day here with colleagues at Kernow CCG in Cornwall hearing about some of the really terrific work that's going on here. I've been hearing about some of the challenges, and very excitingly, I think that there's a great foundation to build on. And in 1819, what I've been looking at is the fact that additional investment is clearly going into mental health. It's going into a range of really important services, which is just brilliant news for me, because my job is to make sure that what we say at the centre is translating into real patient care at the front line, and I've seen lots of examples of that during my time here today. So I've heard great plans for ending out of area placements. I think it was only last week that a new unit opened in the trust. It's being invested in. I saw examples of great partnership between the CCG and the trust to bring back people to deliver better care. You know, well done Cornwall for that. I was talking to a young person just now whilst I'm on inpatient services about their great young person's participation in the development of CAM services. Really brilliant. And they were talking, for example, about giving direction to the builders for the new CAMS unit that will be opening in a year or so's time. And I felt they were going to be really hard taskmasters about what would be good for young people in that setting. But I've also heard a great deal about what's going on in the community. The wonderful Bloom project that our GP talked to me about, which isn't so much a service as a way of getting services to work together in the third sector, the independent sector, primary care, the specialist sector, around actually the needs of children, young people and their families. So another great example. Well done, Cornwall.